Hey guys. So I just wanted to cover today one of the common tapings, which provides a ton of relief if you have an injury or even post-surgery, is the fan taping. Now, the fan taping is always the one that's the most difficult for people just because there's a lot going on there. But I'm going to show you how to do it. I like to round my corners just because it keeps it from sticking on stuff, like if you have a shirt or clothes or anything on it with a horse blanket. So now what I'm going to do is I'm going to cut some little fingers into this and I can follow these lines on the back. I'm going to make about 5 or 6 of them. I'm going to cut up the tape. I'm going to leave about this much of a base so that I have an anchor. And you'll see when I'm done cutting, we call it the fan taping. A lot of people like to call it an octopus because it actually looks like a little octopus with all these tentacles. And so this is what it looks like. And what we'll do is the most important thing that you need to do with this fan taping is make sure that you break each of these little finger protections off completely. A lot of people just pull the paper off and then these fingers are flying and sticking everywhere and it gets really complicated. But we want to tear each part so that they're off the base. Make sure each one is torn. Another good tip when you're applying this, you can fold these little pieces of paper back to create a little kind of lever there that you can grab onto. Because when you're putting this down on the animal or yourself, it can sometimes be tricky to grab that piece of paper. And we just don't want these fingers flopping around and getting stuck to each other. So we're going to leave the paper on them until we go to apply it, but we have this folded back, so it's easy to grab it and put it down. So now there's a couple theories with the fans. Some people say that if you put the fan that basically the blood and lymph will flow up the fingers to the base. So they say that you have to have the base towards the heart, basically, because we want to pump it back towards the heart. We don't want to pump it down an extremity. However, there has been research shown that that's not actually the case, and regardless of how you place it, it will still pump it accordingly back to the heart. So it's up to you if you want to follow that ideology or not of how you apply it. But the most important thing is that we'll pull the paper off first. We'll put the base down, and then we'll put down each of those little finger projections over the inflamed area. So it's a really simple, easy way to decrease inflammation, decrease bruising. And like I said, it can also be used post-surgically. We just don't want to put it directly over the incision, but we can put it on either side of the incision to decrease inflammation post-surgery as well. So that's your kinesiology taping tip of the day. Let me know if you try it and what you think.